Hi everyone, welcome to Neuro335 Population Focused Nursing. I'm Denise Pattison and I am your instructor. Below you'll see my email. My office hours information is on the course wall and we'll go through that in a minute. And let's just go really quick through the course and then we'll just go through the wall. Alright, so course description: models of health promotion, health maintenance, education, disease prevention, and coordination of health care for individuals, families, groups, and communities. We're going to be looking at epidemiology, identification of populations at risk, exploring rural, suburban, and urban environments, and health evaluation in various community settings, and providing a foundation for meaningful experiential learning in the practicum. Through the application of community and public health theory and principles, you'll explore and implement the roles of the nurse as the teacher, collaborator, advocate, investigator, researcher, and direct care provider. So you need to have had some form of sociology as a prerequisite, and this is a 4-credit-hour course. So, learning objectives. You're going to describe the structure and function of the healthcare delivery system in providing population-based care on international, national, state, and local levels. So understanding how we look at populations in healthcare, why looking at populations is important. Oftentimes in nursing or in any patient care, we just think of the patient as the individual per case study and not in populations. So we're going to talk about why that's important. We're going to analyze the impact of environmental, genetic, lifestyle, and economics on the health of populations, specifically now genetics with the change in how much we've discovered with the human genome. We utilize Healthy People 2020 health objectives to assess, plan, implement, and evaluate community-based programs for vulnerable populations. And the link is below. It's a very important piece of writing. That's where we base all our health initiatives every 10 years and set goals for the nation's healthcare objectives. We're going to integrate population-focused nursing, public health concepts, and principles of epidemiology in communicable diseases, chronic disease, and disease prevention. So how do we look at population-focused nursing? Why looking at vulnerable populations helps us understand communicable diseases, helps us understand the pathophysiology behind chronic disease and disease prevention. What about public health concepts can we integrate into our roles in these diseases? And principles of epidemiology, understanding why diseases come, where they come from, how they propagate throughout the community. Describe a variety of population-based nursing roles and current issues that affect nursing practice in population-focused care. So the different areas that nurses can have in population and community health nursing. Conduct geographical-based community assessments of in your city and town, so we'll talk about that. Discuss the use of technology and information systems in providing evidence-based practice in nursing populations. And discuss response systems and nursing management strategies for disasters. So here are the core values. And our instructional materials, we use Stanhope and Lancaster's Foundations of Nursing in the Community, and that's by Elsevier. And then also below, right, this, let me get the pointer out, sorry. Let's see. All right, right here. This is the information on 2012. So that's just kind of a little interesting point. Okay, so methodology, we're going to present things to each other. We have our forum discussions, clinical observation, case studies, etc. And here is the grading, grade point. The grading criteria. All right, so please note The clinical component grade is on a pass-fail basis. You're required to make a grade of 78 or above in the clinical course component in order to pass the component and have passing theory grades counted for course credit. A pass clinical grade is achieved based on achieving an average grade of 78%. So you could go to clinical and do everything great there, but then fail the online portion and then you don't pass. So, but I know none of you will do that, so don't worry. But just so you know, you have to pass the online portion of 78%. So attendance policy. So your attendance is recorded by you meaningfully triggering, which means responding to a forum, turning something in, and that has to be done by Thursday at 11:55 of class, 11:55 p.m. And that is how I count you to be present. If you are absent for more than 2 consecutive classes, so 14 consecutive calendar days, they can withdraw you. So make sure you read this carefully. All right, so online students. So we talked about triggering and what that means. If you think you're going to be late with a trigger, you need to talk to me because I will just count you absent. There's no way to make it up. So we need to find a way for you to meaningfully trigger if you think you're going to be late. So make sure you talk to me ahead of time. If you don't, there's no retroactive attendance points. Okay. So next is makeup policy. So here's the deal. Some of you have had me before in class. I am always willing to work with people on extensions and stuff. You just have to email me. I don't like to chase people. I don't like to say, hey, why haven't you turned this in? In fact, I wouldn't do it if I didn't have to. But they asked me to do it to be kind, and I do it. But in normal school, teachers don't do that. So I really will kind of, I'll remind you guys of assignments here and there, but for the most part, I mean, you guys are responsible adults. You should figure out how and when things are due. And if you're not going to be able to make it, you just have to email me or text me and let me know. If you don't let me know in some written form and you're late, I count it as 0. And then after that, if you try and turn it in, you can turn it in for points. That's going to be super deducted points. And so if you just let me know ahead of time, I work with you. If you don't email me, if I have to chase you down, you're going to lose more and more points. So just be mindful of your due dates. All right. So that's it on makeup policies. Academic integrity. So I want people to really understand what academic integrity is. I keep getting copy and pasted things on their papers. If you even for 1 second copy and paste and then change around a few words thinking that's plagiarism or paraphrasing, paraphrasing can be tricky, and that might be the way you understood how paraphrasing works. That's not how it works. I really just want you to go to the library or to the Learn Center because they will walk you through it. But I turn everything in through the plagiarism website, and it will find it. So please don't plagiarize. Please don't cheat. Please don't copy and paste. Please cite everything that needs to be cited. Please have APA referencing. Okay? So that's on academic integrity. So the Learn Assistance Center. I talk about the Learn Center a lot. If you have struggles with writing, paraphrasing, APA, all of that, you need to seek assistance from the Learning Center. They can tutor you and help you with writing stuff, and they will do online tutoring with you. If to be quite honest, for APA information, I would go to the library because they'll help you a little more. They're a little more savvy on APA. But in terms of grammar and editing, if you aren't really great at writing, I would definitely send all my papers through here, just because there's points in the rubric for grammar and editing and all that, and I will take off points. So if that's not your strong suit, maybe you haven't had a writing class since high school, or your associate's program that was many years and you're kind of rusty, I would definitely just run things through the Learn Center for them to grade you just on basic spelling and grammar. And the same goes for APA. Please go to the Writing Center. I don't allow any APA generators, and I can tell when you've used them because I can't edit them, and then also they're most part wrong. I would say 95% wrong, unless you're using the really fancy kind. And if you do, I won't know the difference. So that answers that question. So make sure you really are taking the time to figure out your APA references, especially with websites. Those are done wrong mostly, and if you don't know how to do it, just the library will help you do it. So go to them. All right, so clinical information. During this class, you're going to shadow a community health nurse in a community health setting. This could be a school nurse, a public health nurse, a community agency like home health. You're responsible for finding your own site, and you have to do 4 clinical visits total, okay? And they have to total 12 hours. They have to be 4 separate. You can't do 1 12-hour day. You can't do 2 6-hour days. They have to be 4 different visits. And they have to total 12 hours, and you're going to write a reflective weekly journal. And those will be due at the end of week 5. All right, so methods for evaluating. We're going to go over each assignment in a second. And then here are all the due dates and the chapters you have to read. So that's the basic syllabus. And the next time we meet, we are going to be talking about assignments that we have to do.